Durlaza is a low dose of aspirin that is used to reduce the risk of having a heart attack in people who have heart disease. It is also used to reduce the risk of stroke in people who have previously had a stroke or mini-stroke, transient ischemic attack. Aspirin is known as a salicylate and a nonsteroidal anti-inflammatory drug, NSAID. Durlaza works by stopping platelets from clumping together and forming blood clots that can cause a heart attack or stroke. It is a long-acting form of aspirin and does not work right away. Other forms of aspirin, immediate release, should be used when a fast effect is needed, such as right after a heart attack or for pain relief. The recommended daily dosage of Durlaza is usually 1 capsule, as directed by your doctor, and it is best to take it at the same time each day. It is important to follow your doctor's instructions and take Durlaza exactly as prescribed. When taking Durlaza, it is important to follow your doctor's directions. Typically, it is taken once a day by mouth, and the capsule should be swallowed whole without cutting, crushing, or chewing it. This is to prevent the risk of side effects by releasing all of the drug at once. If you experience stomach upset, it's recommended to take Durlaza with food or milk. Remember to take Durlaza with a full glass of water unless your doctor advises otherwise. After taking the medication, it's best to remain upright for at least 10 minutes. Additionally, it's important to avoid taking Durlaza 2 hours before or 1 hour after consuming alcoholic beverages. It's important to note that NSAIDs such as ibuprofen or naproxen may decrease the effectiveness of Durlaza in preventing heart attack or stroke. If you need to take a NSAID, it's recommended to take it at least 8 hours before or 2 to 4 hours after taking Durlaza. To gain the most benefit from Durlaza, it should be taken regularly at the same time each day. This will help you to remember to take it and maximize its effectiveness. If you experience upset stomach or heartburn, it's important to talk to your doctor or pharmacist. This medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you notice any serious side effects, such as easy bruising or bleeding, loss of appetite, dark urine, yellowing of the skin or eyes, unusual tiredness, or signs of kidney problems. In rare cases, this drug may cause serious bleeding from the stomach or intestines. If you experience severe abdominal pain, black stools, or vomit that looks like coffee grounds, stop taking the medication and consult your doctor or pharmacist immediately. Although rare, a serious allergic reaction to this drug can occur. Seek medical help immediately if you experience symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. And as always, if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. As with any medication, it's important to talk to your doctor or pharmacist before taking Durlaza if you have any allergies, especially to aspirin, other salicylates, or NSAIDs. It's also important to discuss your medical history, including conditions like asthma, bleeding disorders, kidney or liver disease, stomach problems, and nasal polyps. Using alcohol and tobacco while taking Durlaza can increase the risk of stomach bleeding, so it's best to limit alcohol and stop smoking. And if you have surgery scheduled, be sure to inform your doctor or dentist about all the medications you're taking, including Durlaza. It's also important to note that Durlaza contains aspirin, so it's not recommended for children and teenagers under 18, especially if they have chickenpox, flu, or an undiagnosed illness. Older adults may be more sensitive to the side effects of Durlaza, especially stomach bleeding and ulcers. For pregnant women, it's essential to consult with a doctor about the benefits and risks of using Durlaza. It may harm an unborn baby and cause complications during labor and delivery, especially if used after 20 weeks of pregnancy. If your doctor determines that Durlaza is necessary during pregnancy, it should be used at the lowest effective dose for the shortest possible time. If you're breastfeeding, it's important to be cautious when using Durlaza, as it can pass into breast milk and harm the nursing infant. It's best to consult with your doctor before using Durlaza while breastfeeding. It's important to be aware of potential drug interactions when taking Durlaza. Some medications, such as mifepristone and corticosteroids, can interact with Durlaza and cause serious side effects. It's crucial to keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, be cautious of other medications that can cause bleeding or bruising, such as antiplatelet drugs and blood thinners. It's also important to check the labels of prescription and non-prescription medicines carefully, as many medications contain pain relievers and fever reducers that are similar to Durlaza and may increase the risk of side effects if taken together. Furthermore, Durlaza may interfere with certain lab tests, potentially causing false results. It's crucial to inform lab personnel and all your doctors that you are using this medication. Always consult your doctor or pharmacist for more details on how to safely take Durlaza. If you or someone you know has taken too much Durlaza and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call 911 or the local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of an overdose may include ringing in the ears, sweating, and rapid breathing. Remember, it's crucial to act quickly in the event of an overdose. This medication should not be shared with others. If you happen to forget a dose of Durlaza, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Do not double up on doses to make up for the missed one. It's important to store Durlaza at room temperature, away from light and moisture. Make sure to keep it in a place where children and pets can't reach it. When it comes to disposing of Durlaza, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company to properly discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.